Everyone, welcome to our Friday webinar. I'm Jim Gordon, and my guest today is Dan Winkle, who's Medical Director for Rehabilitation Services at Alameda Health System in Northern California. And we're going to be talking about the challenges that are facing frontline healthcare workers during COVID-19 and the program that Dan has created. And we'll be responding to questions you've asked and looking at the whole issue of how we can deal with this pandemic and support the healthcare workers who are quite literally on the front lines of working with people who have COVID-19 and also working with their families. So before we begin, or as our beginning, let's sit together. Dan, welcome, and let's you and I sit together and relax and breathe deeply. A little bit of soft belly breathing to bring us into this space and this moment with each other and with everyone who is watching us and who's with us, either now on Friday afternoon or whenever they look at the video. So close your eyes, everyone. It's easier, removes a lot of external stimulation. Allow your breath to deepen. Breathing in through the nose and out through the mouth, with your belly soft and relaxed. Remember, this is a concentrated meditation, so we're focusing on the breath, coming in through the nose and out through the mouth, on our bellies being soft and relaxed, and on the word soft as we breathe in, and belly as we breathe out. Feeling our whole body relax as we exhale. If thoughts come, let them come. Notice them. Let them go. Gently bring your mind back to soft belly. Okay, let's open our eyes. Let our attention come back in the room. So welcome back and welcome everyone, and welcome Dan Winkle. It's great to have you here. I want to tell people a little bit about why I invited you to be on the webinar with me. And one of the things that we're seeing in the United States and around the world is the incredible toll that the COVID-19 is taking, not only the coronavirus, the illness COVID-19 is taking not only on people who have the disease and the condition, but also on those who are taking care of them, physicians, nurses, other health professionals. One recent study that was done by the Physicians Foundation, it was a nationwide survey here in the United States, revealed that 50% of physicians have experienced inappropriate anger, fearfulness, or anxiety. Inappropriate anger, fearfulness, or anxiety as a result of COVID-19's effects on their practice or employment. Very high number. 30% of physicians feel hopeless or that they have no purpose. 58% of physicians often have feelings of burnout. This is way up from previous surveys. Nearly 1 in 4 physicians knows another physician who's committed suicide. And 37% of physicians who were surveyed during the pandemic would now like to retire in the next year. So this is a crisis, not only for all the people who have COVID-19 and their families, this is a crisis for our healthcare system. And Dan, I've invited you to come on because I've gotten to know you as you've come through our training programs, and because you've taken what you've learned in our trainings and you've been certified by the Center for Mind-Body Medicine. And as a rehab physician and the medical director for a very significant rehab service with 125 people working in the service, you've taken the techniques that you've learned in our training programs and you've brought them to the staff in your service, who in turn have brought them to the patients. And so I thought it would be really good to talk with you about what you've done and how you've done it, so the people who are watching us now and listening to us, so they could learn from your example. I was really impressed by what you've done. I visited with you before the pandemic, and I was impressed already with how you'd brought self-care and group support to the people in your department. And even as I've kept up with you, even more impressed by what you're doing in the pandemic. So I would like to begin by giving people a little sense of your background, of who you are and what you do. And then I want to move into what's been happening during the pandemic for you and your colleagues, as well as your patients. So first of all, tell everyone what a rehab physician is. What does that mean? What do you actually do? What's your training? What do you do?
So it's a specialty of being a physician. And so it's a residency that you can do that focuses on the restoration of function. And what that means is it could be mental function, thinking processes. It could be things like walking, bathing, dressing. And rehabilitation means somebody who has previously had that function and then lost it. And then using techniques, whether that be medicines, therapies, modalities, things like heat, cold, and all the number of things, too many to list, to then bring them back to functioning and to restore that.
Great, thank you. And so you got interested in mind-body medicine and came to our training some years ago. What made you decide to come? Why did you want to come to the Center for Mind-Body Medicine's trainings as a rehab physician?
Mm-hmm. Well, earlier we were talking to some of the statistics about burnout, and so I was experiencing many of those symptoms, and some of the challenges that come along with that, and came to a point of personal crisis, and what that created for me, Jim. It was a difficult time, but it created a pause in my life, where a lot of things that I was doing just kind of paused, and then I was able to, where do I want to go with this, and what changes do I need to make? And the center's training programs was one of the things that came up for me, so in that moment of pause that came after crisis, I took the leap and went to an event.
Great. And what did you gain from our trainings? You came through an initial training, which was 5 days, and where you learned the science and you participated in a small group and did all the techniques I've been teaching in these webinars. Then you came to the advanced training and learned to use the work with others in the advanced training. And then you took it back out and began to use it with colleagues and patients it was a different rehab facility that you were leading at that point before you came out to Alameda County. What difference did the training make to you? We provided supervision for you as you did that, and then you got certified by us. What difference did that make, and why did you? I understand you got interested in it, as so many people do when they're going through a kind of crisis and they want to look at what can I do to enhance what I'm doing with my patients? What can I do to help me deal with my own identity? And how did that turn out for you? What came about?
So I was thinking about this, and looking at it now, one of the things that came up through working the skills was I eventually learned how I got to the point of crisis. And for me, that was approaching medicine from a standpoint of me as a physician being in a place of authority and having knowledge that somebody else didn't have, and that it was my job to give or impart that knowledge, and they needed to listen. If they listened and complied with that, then they would become healthy. Through working the skills, I came to a place of understanding that that's almost like a codependent relationship where that person is now dependent on me, and I'm dependent on them, and then the demands just became more and more and more until I got to that point of burnout. And so one of the most impactful things for me was moving medicine and this sort of authority idea from the center of medicine. So the first off, I switched this in me from understanding that self-care was the center, and then making a shift from acting as an authority to somebody who still had knowledge, but would use that as a guide to empower other people. And when I made that shift in me first, then began teaching that to others, the weight of the burnout and all of the heaviness and the responsibility of that lifted.
Great, thank you. I hope there are a lot of health professionals who are hearing Dan now, because this is really important part. So on the one hand, these techniques are extremely helpful for patients, and in addition to that, they shift the burden off of our shoulders. We become, yes, we have to treat people sometimes, but a major part of our role and what you're describing is you became a teacher, sharing with other people so they would then have the knowledge to take care of themselves. So a lot of your burden shifted off your shoulders. And I hope this is a lot of the people who are coming to our training come in the same kind of state that you described for yourselves and feel the same kind of shift. One of the remarkable things, of course, is that you've taken this work out and you have used it in the middle of a hospital rehab setting, and that you've actually brought it out to a whole staff. So I wonder if you could describe what some of the stress is, what's going on now for the 125 people who are working with you, which I think is probably a fair sample of what's happening in hospitals and clinics across the country. What are you seeing now with the pandemic with them?
Where we're particularly at, using the skills, there was a high amount of fear. Fear and the stress that comes along with high levels of fear were a very early sign. March, April, the fear was very, very intense. At this point,
what does that look like? What does it look like when somebody in a rehab service in a hospital setting is afraid? What happens then?
Well, I was walking in, everybody's like, yeah, they're tight, and their voice changes, the effectiveness of our communication is down, and that's challenging enough. We're wearing masks right now, Jim. We don't need the extra stress of anxiety. That's an extra challenge. And so when you tack the overwhelming fear on top of that, things like communication, and some of these are the foundations of, we work as a team in the hospital. And so being part of a team and talking and communicating effectively creates patient safety, creates safety for ourselves. And so really it's threatening some of these fundamental things that we use to create a safe environment.
So there was a breakdown in communication. One of the things that I've seen when we're afraid, in various situations that are threatening, is we start getting irritable with each other and banging heads and not really listening. I'm wondering if that kind of thing happened as well.
Yeah. I mean, the general culture where I'm at it's California. It's relaxed and pretty chill at many places. But that changed. We did see the irritability as people worried about their safety, the safety of their loved ones, families, the people we're serving, and themselves. Yeah.
Can you give a picture of that? What was it like for you and for others dealing with COVID-19 in the hospital, and also being concerned about your families? Can you give us a sense of how that affected you and how that affected your colleagues?
Sure. I know for me, coming into the hospital, it was it was scary. I was really afraid. I remember something I was doing in March and April. And what I did is I leaned into the skills. I recognized that I was feeling afraid, and it was a fairly overwhelming, feeling of being afraid. So what I did, and one of the techniques you've taught, has been shaking and dancing. So I would spend a half hour in my office when I arrived at work, shaking and dancing, and then maybe doing another 15 minutes or so, 20 minutes of soft belly breathing, checking in with my body, and then saying, am I ready to move out into the community? Am I settled, so that I'm not being the one that's irritable or yelling or acting out on these different stressors? So my first step is recognizing that I was afraid. There was a lot of fear and anxieties and stress going on around me as a result of the virus and in my colleagues. And then making sure that before I was moving that to settle myself, so that perhaps I could help as a stabilizing factor. And then in that process, then being comfortable when other people were feeling that way, being empathetic to that, and then being able to offer space and skills and techniques that they could then use to attempt to calm that for themselves.
Great. I want to get to what we've done, but I want to emphasize the fact that you're describing rehab medicine as basically pretty chill, as are some services. Some services, there's a lot of pressure in the hospital. Rehab, you have more time generally. So you went from being chill with a kind of relaxed atmosphere to everybody being tense and irritable and having difficulty focusing. And you began, and again, I'm just emphasizing what you said, you began with yourself. And you began by saying, I've learned these techniques. I know that these can help me relax and be more present and help to dissipate the fear. So you started with yourself, and then what? How did you begin to work with your colleagues? Did you bring this work back to your family? Tell us how it spread and what you were able to do, and also the difference that it made.
Sure. A couple things we did when we were recognizing what's going on and that atmosphere began to change was we got together different departments, whether that be a group of therapists, physical therapists, occupational therapists, speech therapists, director of therapy, nursing groups. And I talked with the leaders of the various different departments. And I said, I think our staff could really benefit from using some of these skills. I'm feeling this way. We talked about how they were feeling, and then whether that was appropriate, to offer this. And then just work together to offer that. For the nurses, that was doing some soft belly breathing at a shift change when their they're talking to each other, and so there's 30, 40 people there. We're able to socially distance and take a pause. And there's not a lot of time, 3, 4, 5 minutes to explain what this is, a little bit about our nervous system, and then just sit in soft belly. And then we talked about it. We said, how are you feeling? What changes are you noticing? And just trying to bring some awareness of how that changed their mindset and their body.
So this is really a couple of things you're mentioning are really important. One is that sometimes that what frontline healthcare workers, and also I want to emphasize, often teachers and educators and people who are on the front lines there feel is there's no time. I have no time to take care of myself. Mm-hmm. But how did you get people to begin to take time to take care of yourself? What was the message that you gave that helped that process to move ahead?
For me, it was to talk about how having done the skills, how they benefited me and what I was feeling. And when I do them, how that changes and shifts, and to simply share that experience and to offer that if they, I love the word that you use often, this is an experiment. Let's try it, see how you're feeling. And if you don't feel any, but that's okay, just invite into everybody to feel the way they're feeling, to share a little bit about myself and what I'm learning, and then offer that it may do the same things for them. And most people then feel safe to try something perhaps new or different.
And what was the response as you began to introduce it to the nurses and physical therapists and occupational therapists and the others?
Most people notice an immediate reduction in stress, whatever symptom or whatever way they're feeling that. Most people, when they shared, and some people began, even just from this brief 5-minute intervention, making it a regular part of their life. That was enough for them to go home and practice, or in times that to make that a part of their self-care that they're using on a daily basis. So I think that gave me an insight into the power of, just a brief moment can make a big difference.
I want to emphasize this is really important. This is not about, going off to the Himalayas or a retreat. This is in the middle of the pandemic, taking a little bit of time. And you're saying most of the people notice some difference, just as, on this webinar, people notice a difference after a few minutes of soft belly breathing.
Yeah.
And then they make up their own minds. And as you say, many of them will carry it on and do it when they're not in the hospital as well as when they are. So you began with soft belly breathing and a little bit of explanation about the science and the physiology and how it balances the fight or flight response. But there's another piece that's important. And I know you did some other techniques. You also encourage people to talk about what was going on. Can you say a little bit about that? Because I think that's also an important point. People in hospitals, they'll tell you the facts, what's going on with this patient, what are the lab values, what's happening, what needs to be done. But you're talking about a different kind of sharing. Do you want to describe what that's like?
Yeah, and so we were working on something called a check-in, and one of the advantages, we had started this before the crisis. So we had a number of us that were comfortable with it and understood what it was when we weren't necessarily in that mode. So I think that was an important piece, but it's just an opportunity for people to talk about however they're feeling. For people that, like myself, that are more familiar with that process, to then either be able to offer a skill or support, or a number of things that may look like individual support from myself or somebody else. It may be then listening and taking issues to the larger organization. What is happening in our hospital, part of the hospital, and doing that in a relaxed way. We talked about communication. So if we're relaxed and we're communicating, then we can clearly communicate our needs to other parts of the organization as well. And so it's giving people space, but also collecting information about what's going on with people, and what we can do to support and help as a leader.
Yeah, and I want to point out that a lot of what happened, one of the reasons there's so much burnout is because physicians and other healthcare professionals feel they have to gut it out. They have to keep on going no matter what. And to talk about what's troubling them is a sign of weakness that they shouldn't have. And you, as the leader of this particular part of the hospital, are able to say to them, it's okay. I think what we've found sometimes is with health professionals and people who come to work at the Center for Mind Body Medicine, they're saying, this is different. Because most places, you're not supposed to talk about what you're feeling or show any vulnerability. And, you have to be tough all the time. So how was that received? Did that make a difference for people and individually, and did it make a difference in the whole culture?
Yes, I think it makes a big difference. Again, being, in times of stress or fear, being heard. I had somebody from these check-ins, Jim. This is an employee. She told me a story, and she was facing some troubles with racism in the workplace, and had come to check in with us, and this was causing her a great deal of stress, and checked in, was able to share, feel loved and supported, by our group that we had, using the skills. And then we followed up, a couple weeks later, a month later, and this person said, that before doing this, if I felt stressed, I wouldn't come to work because the work would be more stressful. And so what she said is, now that I know I can check in and I can have somebody to do a skill with, that if I'm feeling stressed, I'm getting in the car and I'm going to work because I'm going to check in. I'm going to work. There's somebody I can talk to. And so creating that creates a culture shift where rather than moving into some place that's causing additional stress, they're moving into somewhere that can help them relieve it and have the tools to do so.
That's really important. And the particular example you're giving of somebody who's dealing with racism is also important. One of the things that we've seen with the mind-body skills groups and with our trainings is as we bring people of different races, different economic classes, different ages and ethnicities together, is as they begin to share in an atmosphere where there's no arguing, where they just have an opportunity to talk about what's going on with them, is that often people start to understand each other significantly better and become less fearful of each other and more compassionate. And they also have an opportunity to look at their prejudices and their preconceptions and sort of check them out against reality without pushing the issue, without saying, well, you have to look at racism or you have to look at prejudice.
Wow.
What happens is people open up and they start on their own beginning to think about these things and beginning to beginning to connect with each other across what were previously barriers between them, barriers of race or occupation or class or age. So it's beautiful what you're doing. It has that other benefit. It brings people together and makes them more accepting and understanding and compassionate toward each other. I'm wondering, though, if you introduce some of the other techniques, aside the techniques we've been doing on these webinars and that we teach in our training programs, in addition to the foundational soft belly breathing, what else have you done and why have you done it and how's it been received?
Sure, we did do a few other things. As a group, shaking and dancing was important. And we introduced that at one of those shift changes. And then there was one time where we just said, there were 5 or 6 of us, and we just said, we just got to take 10 minutes and shake, and just, we kind of made our own little space. We were out in the open, patients were wheeling by. We're just like, but from introducing the soft belly breathing, doing this then earlier, we identified the need to do it and pulled ours. And then as we started dancing, people were coming by in the hallway. Some of our cleaning staff and crew and security people, we started dance. A couple, 3, 4 extra people started dancing with us in the middle of the workday, and we all left. Went from feeling very, very tense to smiling and laughing. There was something comical about shaking and dancing in the midst of in the midst of the hospital. So, yeah,
in the middle of a hospital, in the middle of the pandemic, getting people up to shake and dance, and so, what did people say afterwards? After they, I mean, first of all, how did you get them to do it? How did you introduce it? How did you say to them, we're going to do this shaking and dancing?
Well, I recall, there's a Donna, one of our charge nurses, and she did give me permission to use her name and share that she had been working with me with the skills one-on-one, and so she's a nurse, and these were primarily other nursing staff whom we did this with, and so she did what we talked about earlier. She said, guys, or folks, I'm shaking and dancing at home. It helps me with my with feeling anxious. It helps me let things go so I can sleep better at night. It lets me transition when I get home. I'm not thinking about what's going on with all the patients and with all their problems, and I could be with my family and enjoy that time. And she shared that, and she said it's fun. She thinks it's fun, and said, we're all feeling stressed. Let's take a moment. And so from teaching that, and then I think that's why you mentioned, across races, across disciplines, across age groups. I'm not a nurse. So by connecting and teaching and understanding that, she could speak the language of nurses that I don't know. And so it was about then making those connections. And we talked a little bit about personal empowerment. So then empowering that person, and then, you can partner to build programs. That was a program of 7 or 8 people that made a big difference.
And what did they say afterwards?
We were smiling and laughing.
Huh.
A few good gut laughs, and I do believe that all of us said, it was a shifting point in our day, that, the rest of the day went smoother and much nicer.
Beautiful. Yeah. And I think the other point you're making about, you bring your own experience, you share your experience, and then other people with different professions, different ages, different genders, they get it, and then they reach out to more people. And so the work spreads. And now your department is how many, 125 people in the whole department. This is a beautiful example. And we mentioned, I think on earlier webinars, that we're doing this with whole hospital systems at Eskenazi Health and with the VA. And this is the kind of self-care and mutual support that is so crucial during this time. And what you're doing is such a beautiful example of how one person, you come to and you're even pretty new in the hospital, but as people get to know you, you're sharing what you're learning and what's working for you, and then it gets more. It gets kind of wider currency. Other people get interested, and you start with the people who are interested, and it keeps on growing. So it's beautiful, and that's one of the things I was drawn to, is the picture of you shaking and dancing with staff. Fantastic. So we have some questions, and Dan, let's turn to the questions now. First one: I'm a frontline healthcare worker and feeling the psychological toll of this pandemic. I'm struggling. I also see my colleagues struggling. We're working long hours and are being called to perform duties we had not previously expected. How can I support them and myself? So what are your thoughts about that?
Yeah, that's, I've been in those situations, maybe in those particular situations, those are difficult circumstances to be in. I think to feel stretched in that way. I come back to one thing coming up for me. I was following up with another one of our somebody I'd done a lot of skills with, I was asking questions. How are these making an impact in your life? And so what I'd come back to the skills, and one of the troubles in the hospital is finding the time and a private place to do so. And so she shared a way that she was finding to do skills was to find this space in the restroom, find somewhere where you can go and you can breathe. Maybe you even got to tell your super, I got to go to the bathroom, but you go and do some soft belly breathing. People understand that. So I got to care for myself. So it would be to find a way to create those moments of self-care if somebody was feeling overwhelmed. And I would say it's coming back to this thing of before worrying about colleagues, do it for yourself. My example of being in my office for 40, 50 minutes, I was making sure that I was doing my self-care before doing that for others. When you feeling that fight or flight calm down and that sense of overwhelming, that might be more of the time. Or do it if it's coming up for you in the moment, and that there's that opportunity. Do it with someone else. Sometimes that may be what you need. But I would say sinking into the skills and checking, impulses or gut feelings about what's coming up, because that answer is going to look different for everybody on how to approach it.
And what you're talking about also that you've made clear is that you've got to get yourself into balance first. That the best way to help your colleagues, or in order to help them effectively, is to take care of yourself, so that when you go out and share the possibility of using these techniques, that you're in a balanced place. And it's not like you're saying you have to do this, and you're not yelling and you're not preaching to them. You're just sharing from a place of understanding and compassion, as well as from your personal experience. And the other thing that you've said is that you're giving people a chance to talk.
Mm-hmm.
And I think that's crucial as well. People need to have a place to say exactly what this questioner is saying. I feel so stretched, I feel so overwhelmed, and be able to share that. And then a next step that I would suggest for this questioner is to think about some of the imaginative techniques that I've taught in these webinars, like the guided imagery. And what I would suggest is that, once you've come into balance through soft belly breathing or shaking and dancing, that people need to sort of sit for a while and say, okay, this is my situation. Let me mobilize my imagination. Let me communicate with that wise guide, or let me do that written exercise, that dialogue with a problem, symptom, or issue. And we've done all these, Dan. You know all these techniques. I know we've done them in these webinars. And then when you have time, maybe at work, it may be at home, see what you need to do. Because it may be that you need to take some action. You may need to talk to somebody about what's going on, that it's too much. I think the other thing is that people who are in our profession, so many of us are super conscientious, and we never want to say no. We want to keep doing whatever we're asked to do, whatever is necessary. We're there to serve our patients. But at a certain point, and that's what I'm reading in this question, and that's what you were saying about yourself at a certain point in your life, you get overwhelmed. It's just too much. So that's the point where you need to go inside and ask yourself, ask your intuition or imagination or your unconscious, your inner wisdom, what do I do? How do I deal with this situation? And I think it's going to be different for each person. One of the things that when you went and sort of thought or gave yourself a little time, you said, I need to learn about mind-body skills. I need to do this, and I need to make this a part of my life. And that may be the answer for other people, and there may be other answers. Maybe you need to talk to the supervisor, or you need to, meet with your colleagues at the end of each day, or figure out a better way to deal with these responsibilities. But I think that the coming into balance is the first step, and then using some of these imaginative techniques as well. Let's go on to the next question. As a leader in a hospital system, I want to support my employees and patients in a better way. What can I do? And it's really nice to have a leader in a hospital system, I don't know who it is, asking this question. But what's your advice to that leader? What would you suggest?
Well, I really like some of the earlier ideas we've had in our conversation. One, you can go to if you haven't already, go to a Center for Mind Body Medicine training. But it comes back to learn, which is one way to learn the skills. There's other ways to learn the skills too, through take a moment if it's something that's maybe uncomfortable or something. Try it. Come back to the idea that these are experiments. Offer that in with the process of talking a little bit about the skill, maybe your experience or the science or whatever you're comfortable with doing it, and then giving an opportunity for people to then talk about how they're feeling, and the other in whatever way works for your department. And what I would say is, with starting them, if it's something that's new, work with somebody you're comfortable with. Sometimes when I was first learning these, I'd call up a good friend who's not in medicine, who I know if I make a mistake or it was a safe place to experiment. And we would learn about these together, and it deepened our friendship in a very real way. So whatever, feels right, to start with that. And a check-in, check-in's a formal thing, but even to just open that communication, to open up to people to talk about how they're feeling. You mentioned, Jim, holding on to all of these challenges, fighting through them, in a way that feels alone. And so open up to listen and allow people to be heard, I think could have a profound impact on the feeling and stress and culture.
That's really important. One of the things that I've heard, we've done this program on a whole hospital system-wide level at Eskenazi Health in Indianapolis, where Lisa Harris, who's a nephrologist, is the CEO. And one of the things that people have said in the hospital, doctors, nurses, other clinicians, is that the leader's attention, caring about them, her interest in bringing these self-care techniques to the people working in the hospital made such a difference. So I would say to this leader and all leaders that first thing is be interested in what your employees are going through, number one. And then as you feel comfortable with these techniques, and as you learn them and you see the benefits, start sharing them with other people. And I think your point's a really good one. Start with where you're comfortable sharing with other people. And then it will gradually expand as you get more used to the techniques. One of the things that people have told me is that, they've read The Transformation, my book. Sometimes they share the book. Sometimes they share the techniques and the book. And they start in a way that's comfortable for them. The other thing I want to mention, you mentioned people should come to our training programs, and that would be beautiful. But as I would suggest to leaders, including this leader, is take a look. Look at one of these webinars. Look at some of the things that we're teaching. Invite us to come and do a workshop for your hospital staff or for your leadership team, and just give people an opportunity to experience and ask questions and raise their concerns. That's the way we begin our partnership. So we start from where you are, and I welcome any leaders, hospital leaders who want to get in touch with me. It's jgordon@cmbm.org. Please get in touch. We do this all the time. Want to go to the next question, if we could. Many of my friends and family do not think that wearing a mask is important. How can I encourage them to wear a mask without upsetting them? So, Dan, I wonder what you think about this one.
Well, yeah, we all have those family members. I know I do. That's a tough, it's a tough question. To me, and I working the skills, I feel pretty healthy. I'm fairly young. For me, you know, the mask wearing is an act of empathy, of understanding empathy, and saying, you know, I care about this other person. You may be vulnerable. I don't want you to be you know, to pass something along to you, you know. And so that's what it, you know, what it means to me. And to do, you know, sometimes simple things could stop the spread of the pandemic. There's good data coming out, you know, where I know where I'm at in California. It's pretty serious. Many people are wearing their masks, and we're not seeing the magnitude of surge that they are in other places. And so we're learning that it really works.
One of the things that you told me, which was quite remarkable, is since the pandemic began, you've had 500 people come through the rehab service that you're leading, and that none of them has tested positive. What do you? I mean, that's extraordinary. What do you think has contributed to that? How do you think you've helped to convey to what have you done? What's gone on?
Well,
sure, totally, but it's very striking. So, what would you say about that?
it is, and to be honest, there's still a lot of mystery in that number of how that's possible, because I don't believe that's the generalized experience of rehab hospitals across the country, from talking with my colleagues in places that haven't. I from my personal perspective, I connected to skills in the culture and the environment of support and safety that creates, and when as a healthcare worker we feel settled, we feel that less stress level. You mentioned when we're yelling at people, we're agitated. The people are here to heal. We don't need to be the one. We're here to serve them. We don't need to be the ones agitating them. If it's, you know, it doesn't mean that people aren't going to get agitated, but we want to be the ones to be a stabilizing factor for that. And so I do think that the skills in us doing the work as a group, to feel settled and to settle down that fight or flight response for ourselves, creates a trickle down, you know, effect that creates the healing environment and a healing community for patients to come in and do better, and to get better outcomes.
Yeah, and one of the other things you mentioned that I, as you said, at the beginning of the pandemic, a couple of these 125 staff tested positive, but since then others have not. So you're doing something clearly right in that in this world that you're, you know, that in which you're living and working, and where you're a leader. But I want to mention one other thing that just came up. One of the people who's watching the webinar, who's come through our training, who's a chief of medicine in hospital in University Hospital in Pittsburgh, Michelle Thompson Olson, said she's saying that the University of Pittsburgh Medical Center Psychiatry Department is ready to implement mind-body medicine, and they're in a meeting soon to discuss the next steps, which is wonderful. This is how it can spread, and I think, you know, we're seeing an example of how it can spread once leaders like you and like Michelle, who she's a physician also, of course, who's leading this program, are committed to it for yourselves and sharing it with others. But the trickier part is, how do you talk with people who you've created an atmosphere where you're saying, this is the way we do things here. We wear masks, we deal with our stress, we come together, we learn techniques. But what about those people who either walk into your unit, or you're seeing around you, or family members who think that wearing a mask doesn't make any sense, or they don't want to do it, or it's too much trouble? Do you have any thoughts about what have you done to deal with them? How have you made it, any inroads there?
One of the things I'm seeing that is to set these, when these issues are coming up for us, to set some boundaries. You know, there was somebody who didn't want to wear them, and they had to stay in their room. Or you know, if you're coming in from the outside and you don't want, you're just not able to come into the hospital. And I think it's important to it's so important to create that space and ask questions about why that is for them. I think the questions can create, it may not change their mind, but I think they can help create a level of awareness in that person too.
How do you do that? How do you create that space for a discussion from somebody who says, I don't think I need a mask. I think it's a hoax.
Well, what's coming up for you? Why do you feel that way? You talk about this at time, a genuine curiosity of wanting to know why they feel that way, and to understand that. It usually, if we listen to enough of those questions, it does make some sort of sense as well.
So giving them a chance to speak as opposed to arguing with them or just dismissing them. Because I'm sure family members, if not patients who come to you to the rehab facility, some of them have not been using masks. Is that right? Probably true.
Yeah, no, it hasn't been too big of a problem that I've been aware of. No.
So when they come, by the time they come to the hospital, they're wearing a mask.
Oh well, yeah, we have security. There's screening. People are checked and only allowed in certain ways in the hospital. There's a whole process of it. One, making sure that you're feeling well, before coming into this space, that you understand that this is something that we're doing. We've decided as a community, and so we have. People, help and screen and make sure that folks understand what's going on before they come in. And with that, it hasn't been too big of a challenge.
So partly what you're talking about on an institutional level is a program of education of all staff, and then education on the spot of people who are coming in to the facility.
And in the instance, speaking to the power of education, Jim, in that instance of somebody not putting their mask, being in the room, what I did as a leader was then talk to one of the physicians that was helping and say, hey, can you just go and talk to them about coronavirus and what this is, how serious it could be, and why we're doing this. And they did begin to wear one. So it's that, open communication was what helped us, help move through that challenge.
Good, and I would suggest that, and I think you mentioned this earlier, that open communication is one with family members and friends as well, people who are not coming into the hospital but not wearing a mask and putting not only themselves, but as you point out, putting other people at risk by not doing that. Okay, another question. Why do we feel lonely sometimes, especially more so now these days? Where does that feeling come from, and how can I feel less alone? And I'd like you to focus on how you're helping people who are, part of a rehab medicine unit, who are coming, who already have, disabilities or limitations of one kind, which already make them feel lonely. How are you helping them deal with the increased loneliness of the pandemic?
Mm-hmm. It's tough right now. There is a level of isolation. Still shelter in place orders and different barriers to this. Some of it is rethinking the way that we're connecting. Some of the ways that we used to connect with each other are not things that we're doing right now. And as one of the things I'm learning too is being more open, understanding the importance. So you mentioned communicating with family, to be checking up that for us, nurses, social work teams, myself, that because we can't meet them in person, to make sure we're using the tools we have, the telephone, Zoom calls, and different ways to keep them connected to their sources of support that they have in the community. And then the other part is, as I'm working with somebody, or now the staff that have familiarized themselves with the skills, is to make sure that patients in particular are free to express those feelings if they're coming up for them. In a real open, and maybe aloneness isn't what's coming up, but a phrase is all feelings are, all ideas, are welcome to bring up, and as your physician, these are things we can talk about, and we can face them together. And so to me, and that's something, as I first meet people, we're going to do our history and physical, helping them get checked in for the process. That's something that I like to talk to about anybody that I care for.
Yeah, I think this is really important for anyone who's a health professional or any kind of helper, that there's so much that we can do by tuning into what's actually going on. People may come, they may come with a with a broken leg for rehabilitation, and to be looking for issues related to loneliness. And, I know for me at various times in my life that I have both found physicians and other healthcare professionals who've been very important to me when I felt lonely. And I know that I've also done my best to be there for other people. I think the other issue that I want to address for loneliness, which we had a whole webinar on this, so I encourage people to tune in to the webinar, is that it's important to get in touch with those feelings of loneliness and to say, yes, they're there, and to express what's coming up. And what's coming up may be anger. I'm angry. There's nobody here. So you got to get that anger out. Maybe jumping up and down or screaming and shouting, or maybe writing it down. And if there's sadness, give yourself time to be sad. One of the things that I've noticed, and sometimes I've awakened during these last 7-8 months feeling lonely. And what I've found is that a morning routine that includes physical movement and exercise, and sometimes shaking and dancing, and sometimes yelling and screaming if I'm feeling frustrated, that as I come more into balance and I release the feelings that are making me feel, you did this gesture earlier on, and sometimes I wake up feeling a little that way. As I let it out, I start relaxing, and the loneliness starts to dissipate. There's nobody else around, but I don't feel so lonely. I feel I'm alone for sure, but I feel more present, more relaxed in my body. Loneliness creates anxiety, agitation. Loneliness puts us into fight or flight. So if we can reverse the fight or flight by soft belly breathing or shaking and dancing or sharing our feelings, then the feelings of loneliness dissipate. And at that point, we're in a position to be a little more open to our imagination and our intuition. And what I suggest that people do is just close your eyes for a second, see if there's somebody you want to connect with. And lo and behold, somebody is likely to come into your mind. So what popped into my mind at this moment is the next time I'm not feeling particularly lonely, but Gerald, the homeless guy who sort of makes his rounds on my block, next time he comes by, I got to go out and say hi to him and just spend a little time with him. It just spontaneously popped into my mind as I closed my eyes for a moment. He appeared there. So I want to encourage people who are feeling lonely during this time. Use these self-care techniques to bring yourself into balance, and then allow yourself a couple of minutes to think about who or what do I want to connect with. And right now, Dan, our time is up. And I want to thank you for the example that you're setting, and for the beautiful way that you're working with your team, with these 125 people whom you come in contact with, the employees, and then how sharing with them also is beginning to bring this work to all the patients who are coming through your service. I'm wondering, is it okay if people who are watching get in touch with you as well as with me?
Oh, yes.
More about what you're doing?
Mm-hmm.
How can they do that? What's the contact information?
Yeah, I'll give you my email address. It's dwinkle, so DWINKLE 101 @gmail.com.
Once more.
dwinkle, DWINKLE, the number is 101 @gmail.com.
So great. Thank you, Dan. Thank you for doing such such beautiful work and for being the beautiful human you are, and for sharing your experience with me and with everyone else. We're going to conclude with a minute or two of soft belly breathing. So let's just breathe together, relaxing as we close the session, breathing slowly and deeply, in through the nose, out through the mouth, with our belly soft and relaxed. Thoughts come, let them come, notice them, let them go. Gently bring your mind back to soft belly. Okay, let's open our eyes again. So, next week we'll be taking off Friday, Thanksgiving holiday. Hope everybody has a good Thanksgiving. The week after, Dr. Will Cole, who's doing some very interesting work with nutrition during the pandemic, will be my guest on the webinar. And then in the weeks ahead, Representative Tim Ryan, who was originally scheduled. And Dan, thank you so much for being willing to come in and be here on short.
It was my representative where I moved from. So
yeah.
Yeah.
Tim is a good friend who's written about mindfulness and nutrition, and who's going to be very important going forward with the Biden administration. Tim and I will be talking about some of the ways we can make this work part of health policy in the future, and some of what his plans are, and some of the possibilities for collaboration. So he'll be coming on in the weeks ahead, and so will Miles Taylor, who was at the Department of Homeland Security and left, and he was anonymous in the New York Times, sort of op-ed pages, and been an important voice for understanding the stress and the sort of contradictions that arose during the Trump administration. So Miles will be coming on, and Lynn and Bill Twist will be coming on to talk about the importance of the environment and how we can bring together efforts to deal with climate change with mind-body medicine. And we're going to be continuing throughout December and January, and a number of other people will be coming on. I think the actor Robin Wright will be here with me in January and talking about her new film, which is about psychological trauma. So a lot of interesting people. And again, thank you, Dan, for being with me, and thank you everyone for being with us, and have a wonderful Thanksgiving, and we'll see you back here on Friday, December 4th. Bye-bye for now.